call the meeting to order. All those in favor?
Time
Okay.
is,
The time is, what is it about? Let's call it 8 after 7.
first thing on the order of business is the minutes from December, and all they are that's different from the meeting notes, what we got for minutes were the dates for our quarterly meetings. So, and those dates are March 19th, which we already didn't make, June 18th, September 17th, and December 17th are the scheduled dates coming up.
Okay, June 16th.
June 18th,
Yeah, 18th.
September 17th, and December 17th.
Okay.
Okay, so otherwise it was the same, and it's on the
Cast in stone, right? Yeah.
health department website, it's there.
Are we gonna meet here or downstairs? You don't know.
That is dependent on what Gene assigns us to.
Okay.
So we'll find that out and
Okay.
we'll let you know in
Okay.
advance for the upcoming meetings.
All right.
I don't think that she's gotten that far ahead for scheduling. So just going by the notes, the first thing I wanted to talk about was our food protection program. We're doing a good job of staying current and up to date. There are a few places that warrant attention. I mean, they're just there. You can see it on our website. Over the past several months, the restaurants have been getting a fair amount of attention from the media, both on TV and in the paper. But we're one of the very few jurisdictions in the state, and I think the only one really, that actually posts the complete inspection report, as well as doing ratings. There's only 7 other departments that do ratings and put them in the windows. And of those, the only thing they put online are the ratings. They don't actually have the inspection reports. So I'm pretty proud of that, in fact.
I've read them, they're good. Good to know what contributed to the rating.
Yeah, it makes a difference to actually have reference to say, why and what was it about.
Yeah. Makes you care about the rating more when you read those.
And along those lines, what we've done is we just recently were able to start viewing how many times the ratings component of our website's being looked at. And in this last quarter, there were 313 viewings of the ratings page. I know I didn't make up half of them, but I looked there a few times. But that's more than the last time, and I think it had a lot to do with the media attention that was given to online restaurant inspection scoring and ratings. But that's a good thing to know because it's being utilized. And of course, the Dairyite comes in once a week on Thursday afternoons and takes all copies of all our inspection reports and does a piece on that every week.
I've seen that, yeah.
Every week he says it's one of the most popular parts of his site. So moving forward, this is the time of year when, we're getting into the warmer time of year, seasonal food service operations, snack bars, the beaches are gonna open, so we're starting to gear up for permit applications for that. A lot of outdoor events, stuff goes on almost every weekend through the summer and fall. Starting soon. Hopefully it'll get warm soon. The update on the FDA food code adoption is that, January 1st has come and gone, and that's when it was supposed to have gone into effect. It still hasn't been, the regulations still haven't gotten out of OPM, so there's no change in the food code. I'm just thankful that we didn't spend a lot of time changing our regulations when we don't even know what the ultimate code is going to be. A lot of departments already have done that. So right now there's legislation that DPH is proposing to extend the implementation date for the new code to January 2020. We'll see. I'm not going to hold my breath on that one either. But
OPM is state or federal?
state, it's the budget management, it's fiscal notes, and, you know, it's, and, you know, they're looking at the language, and I have my doubts whether they're going to approve it, because the regulations that were submitted give an awful lot of latitude for local health directors to close facilities in questionable due process associated with that. And I'd be really surprised if they allow for that much latitude for closure. It's an opinion, but anyway. In planning for the adoption of the new code at some point, we're working with the other health departments that do issue ratings to try to come up with a uniform approach statewide to actually have a rating that's based on the new inspection form that actually is not point-based. So currently, our ratings are pretty much tied to a scoring system that has point demerit system associated with it. The new code doesn't have that. So we're working with a series of different what's plural of matrix?
Matrices.
Matrices?
Yeah.
Thank you. To try to figure out a way that we can uniformly apply a rating for the different departments. Currently, Norwalk has lighthouses, and there's other symbols and terminologies that are used elsewhere for ratings. We're going to try to unify it into the letter grade, such as what we have.
I mean, that seems to be so easy to understand.
It's intuitive. We understand an A.
Yeah. and an F.
It's intuitive. So, you know, and then finally, once the code gets adopted, we'll need new enforcement policies. And it's going to be a little tricky for us because no longer will a restaurant actually fail its inspection. So that's why the matrices are really important to figure out, so we can actually have a failure on a non-scoring system if they have certain numbers of violations of certain types. And that's what we're working on. It'll be interesting getting different departments to agree. But we're working on it.
Maybe a lighthouse with a letter on it. That's a compromise.
Could be. Could be. Any questions on our food program? But we're good with our inspection frequencies right now. Reportable diseases and conditions, as every quarter, and since I've been looking at the numbers from our EMS, falls are number one. Injuries associated with falls. The second bullet point is kind of interesting because we now have access to emergency admissions for Darien residents on a statewide basis, not just in local facilities. And even with all the news and publicity associated with opiates and drug overdoses, our big issue here in town is alcohol and alcohol-related admissions. More than double the amount of alcohol in emergency room visits than overdoses since June. So that's something to think about.
Do you know how many of these falls are alcohol related?
Don't, and that's actually a good question because we've been talking to Joe from the EMS to try to get that, you know, for all calls. Motor vehicle accidents, they don't tease that out. So what we're going to try to do is to get that information to say, okay, you know, this is a category because the alcohol-related calls is a category. But if there's an injury associated with it, it may not be.
No, right, it might be secondary to.
Right, so we've been talking to him about expanding their case definition and reporting system to be able to show us that. If it's substance abuse contributing to the call. Yeah, good. That's a good point because that is something that I think is important. In the back of your packet, there's two graphs that I'd like to point out to you. That goes with the third bullet. And it has to do with STDs over the past several years. The first bar graph, 5-year totals by age group, is interesting because it shows how prevalent, how the level of chlamydia occurrence and how it is kind of front-loaded, obviously, to the younger, to under 30. And actually, really, it's under, for the most part, under 25 in town. And the rest of the, by age group anyway, the numbers aren't terribly high. They're there, but the number, this goes back to 2013. It's a cumulative number for that age group. And then the next one is just a summary of the different STDs by type, and that's all ages. So there's something of an increase overall with chlamydia, but there's a definite increase with syphilis. And that's consistent nationally with what's going on nationally.
Is this syphilis a strain that is amenable to treatment or medication, or?
I don't get that kind of information.
Yeah.
It is,
It is
okay,
treatable,
okay.
yeah.
Now, what about, because I don't see it in the graph here where they say the baby boomers and hepatitis C, do we have any information?
We
on
do,
that?
and that's not part of this graph, but I can
Okay.
certainly get it, and that's part of what we do when we do our annual report.
Yeah,
But Hep C is definitely in the top 5,
yeah. Mhm,
you know, most reported.
mhm. And in town here?
Yep,
Wow.
yep, it's definitely in the top 5. Has been consistently.
Okay.
And for the record, last quarter was the first time that something took over from STDs as being number 1, and that was flu. We had a fair number of flu cases through the last quarter. Any questions? on-
So what are we doing in the schools related to STD prevention?
What are we doing?
Well, I'm not there, I know. Is anybody from the health department or the
We've been in
schools and nurses?
We've had conversations with the head of nursing, with the director of nursing,
In here, in the
School
health
system.
department or in the
School
schools, the
system.
nursing,
school system.
the school
nursing.
system? And what's their feeling
And
about this?
trying to, we were looking at becoming at least contributing advisors to curricula development. And we have not been able to get into that. So it's an ongoing working relationship with the administration and with all the changes there have been with the superintendent. It's kind of hard to get to a place where there's somebody who wants to make that decision.
And then what would be the parents' input? Or do you think there might be any pushback from parents
Yep.
about this?
Yes, I
Yeah.
do. We anticipate that. I mean, just last year's reception that there was at the depot.
Yeah.
Yeah.
At the depot, when there was discussion about having somebody come in for Planned Parenthood, I think there would be quite a bit of pushback.
Okay,
You know, but that's the whole point in getting this message out.
right.
And so, you know, that's one thing that Paula, our nurse, and I have been trying to work on with the nurse at the schools to see about getting a more proactive involvement. The other thing that we talked about here, at the health department here, was to just make a more pronounced part of our website be dedicated to this issue.
Mm-hmm.
Try to gain
That
it.
might be a good idea.
You know, because, I mean, if we're not gonna get it there,
Right.
we could at least make it be more pronounced.
Then it's more accessible for the kids to read it themselves.
Right.
So that's the tack that we're kind of working on. I just have to kind of put all this together. That's why we're doing the graphs.
And
You know,
at least
try to
they're
pull
gonna
that
get
together.
Right,
information
and to
that's
see
correct.
them,
You know,
yeah.
and that's a big story, that big bar there on the kids that are, and I'd say kids, because the primary numbers, when you really break it out, are between 18 and 24. That's probably that's most of that.
So they would, that's the college age.
Yeah, when you're leaving for
So
college.
we're going to college and everything gets kind of wild and crazy,
Yeah,
really to arm them prior to going,
exactly.
like in high school.
Yeah, I think that's
So,
an important piece. I see that being a role that we could fill, and I think the best way for us to do it is to create our own information system.
Right, okay.
I think it's an excellent idea.
Yeah,
Then they can go on and read it themselves
yeah.
and get the correct information, which they don't always get.
Mhm.
And they can think about it themselves.
Right, this is all confirmed, this is all laboratory confirmed, this is
Yeah.
not conjecture.
Oh, no, oh, no, no.
So, these are solid numbers.
I wonder if all these students with the emergency medical, the
Posties?
yeah, the posties, if they were empowered with this kind of knowledge and information, if they could just kind of share it among their peers, as kind of a target group to maybe outreach to, since they're dealing with so much illness and accidents and whatnot, some education of them, because I'm sure that would just even get around verbally with all their friends.
We certainly can talk to them about that. Right now, we've been trying to get the other information from Post with respect to that substance abuse piece.
Right.
And sometimes change doesn't come easily,
No,
but we can
no.
certainly check that. There's no
Yeah.
harm in asking.
Yeah. I mean, because they could be a really great group to target, to educate, so that they could, reach out to their peers
Right.
formally or
Yeah,
informally.
they are, it is
Yeah.
quite an asset.
Yeah,
It really
yeah.
is. Okay. Next, our flu program. We've used up almost all our vaccine. Did pretty well. We had actually ordered more than what we initially started with because there was a bigger demand this year. We administered a little bit more this year than last, and we're going to maintain levels. For several years, our numbers of vaccines that we've given out has declined, and I think that's in large part due to the wide availability of vaccines easily, in places like CVS and Walgreens, and people walk in and go shopping, can get a flu shot without an appointment, and we were always clinic-based. So we changed that, added a scheduler so that people could actually schedule appointments with our nurse. And, when we still had our clinics. And we're holding our own now for the last 2 years, 2 years or so. It's, I think it's a pretty valid service and will continue. I was thinking for a while there, it was looking like we were just gonna phase right out of doing this.
Do people use the scheduler?
Yep.
That's good.
They do. So, it's worth it for us to maintain it because it costs all of $19 a month to pay for the service. And I think for what it does and the convenience that it provides the residents with, yes, it's worth it.
Because the numbers were up this year, weren't there, of incidents of flu?
Yep, and this, as I said, we even had, and I don't think that most doctors report cases of the flu, but reported cases of the flu this year were higher than we've seen before. So, upcoming special events, we're going to be partnering or sponsoring our own events coming up. The first one, What About Weed? Again, in the packet, there's a flyer, a discussion about marijuana. That will be here in the town hall at the end of the month, April 24th, focusing on how marijuana affects teen brain development. The intent here is to try to attract parents of school-aged children, because I don't know if it's going to pass in legislature this season,
Looks
or
like
next.
It might.
It might, it may not. The reality is, the issue's not going to go away. And the issue's here anyway. Kids are using pot, and it's getting even harder to figure out that they are with vaping. So I think this is a timely discussion. See what happens in the legislature. We, as local directors of health, Connecticut Association of Directors of Health, submitted testimony basically opposing adoption for marijuana, saying, we're in the midst of an opiate crisis. It's kind of sounds duplicitous if we're saying okay to certain drugs and not okay to others. But recognizing the realities of the financial situation of Connecticut and saying that if we do legalize it, we need to allocate a certain amount of that money that comes from taxation to treatment and educational programs. Absolutely essential.
I
But
wrote my state rep, I wrote the state rep saying that I wasn't opposing it myself. But I also wrote that I didn't think it should be criminalized, that maybe
No.
that they should change it to like, what message do we want to give? Maybe get like a parking ticket kind of a thing, $10 or $20 ticket for, in the public or something like that. But I opposed it on for many reasons.
Well, there's lots of reasons to oppose it, and the only reason, really, from my perspective, that I could see to make it be.
Financial.
No, not really.
No?
It's because if it's coming from a legal source, at least you can trust that it doesn't have other additives.
Right.
And I think the issue today is, what are they putting in it?
It's such a criminal element to it.
Yeah,
Well, we don't even know what half these kids are really taking when
you
they come in.
you
We
don't know.
No.
It's so mixed in the background, and they mix it with everything, and it's very bad.
And that's from again, a public health perspective. The only public health reason that I could see to do that is to at least remove that element from the equation. And it won't ever remove it because the criminal element will probably undersell because it won't be taxed, right? So it'll be cheaper to buy it off the street than maybe from a corner dispensary. But it's tricky business. So anyway, this is coming up. I'm pretty excited about that.
Do you know, let me ask you one question about that. One of the arguments that I had against it is, do we have any, I don't think we do, any way of measuring the amount of marijuana in the system if they were driving
No.
while under the influence?
You
Yeah,
do
as
not.
far as I know, we don't. And
You
that was
don't.
another reason to object to it,
Yeah,
at
you
least
don't.
at this point.
So you can't tell, like, measure blood alcohol.
Right, no.
Is there an intoxication
No,
level
no.
where you're impaired? You
Right.
can't do that
No.
with marijuana. And marijuana stays in the system for a long time too, so you may have it detected in your system and not be currently under the influence. So, yes, that is an issue with it. Also coming up at the library, we're going to have a couple speakers from the Connecticut Agricultural Experiment Station come in to talk about mosquitoes and ticks and diseases and controls and what you can do to protect yourself and and probably weave in some issues about the dreaded terminology, climate change, and how our risks are changing and the spread of different types of mosquitoes is increasingly coming north, and so we're maybe facing different types of illnesses than in the past. We will also be participating in the farmers market about once a month. We went last year. That worked out really well. Blood pressure checks for free to the public and information, and it's basically answering questions and giving handouts. Trying to increase the exposure for the health department, telling people what we do. Reminding them to look for ratings in restaurants. And in the fall, we've been recently doing some inspections. We do our salon inspections twice a year. And once in September, October, and once now. And in doing the inspections of our facilities, our sanitarian, Mindy Chambrelli, came across this product that was being used in one of the facilities. And when you read this, there's a caution statement on it, and it says, this product must not be used for dyeing eyelashes or eyebrows. To do so may cause blindness. So guess what they were using it for? Eyelashes and eyebrows.
Oh my goodness, who was?
Well, I'm not gonna mention it right now.
Is this somebody,
So this was on a Friday that she told them to get rid of it, and on Monday, I went back to the facility and I found them in a jar in one of the rooms. So I took them. And I said to the owner who was there, I said, it says it may cause blindness. And I said, you understand what blindness means, right? I mean, we're not talking about irritation, we're talking about blindness. Salons can be a source of significant infections. In Connecticut is the only state in the country that doesn't license nail technicians, eyelash technicians, or estheticians. We do not. We're the only state in the country. There's a bill now to do that. We wrote testimony in support of that. In September, we plan on putting together a program that will outline risks associated with these types of facilities. Now, I'm not going to say women in general take these places for granted. We can do an inspection, one day, and we take this stuff away. It doesn't mean that there's not going to come out as soon as we walk out the door. It's a real tough business. So my message to anyone who uses facilities, nails for manicures, pedicures, is to make sure that the technician washes their hands before they work with you. Make sure that basin is cleaned out. You should probably get your own tools. Bring your own tools if you're going to be getting your nails done. Because I can't guarantee that they're doing the right methods of cleaning and sanitizing.
I've heard that, people bring in their own.
Oh, I encourage it. I bought my wife a set just recently, but for years it was just a discussion item for us. But so anyway, we're planning to have a session in the fall to discuss this further, because we think this is a big publicity item that people who go to these, and Darien, let's say the numbers of these facilities in town, we've added 10 places in the past year. 10 new facilities. So, and that's not going to slow down.
the one I went to had sterile packages that they opened up, but then they had like clippers that were not in that package, and I said, how do you sterilize your equipment? And I don't think it was, because if it was sitting there, it wasn't like they went somewhere and were using the same clippers. So that is a problem.
But you don't know that they sterilized the things before they put them in the bag.
No. Well,
And-
that's,
And we know there are
but I
places
think it was
that
a
don't.
sealed bag. that
It
they
is.
opened.
They know how to seal them. They seal them. There's all kinds of tricks.
Tricks.
It's an interesting business, and the more time we spend in these facilities, the more we learn about ways to do things and ways not to do things.
I guess I should bring my own dentist tools next time I go to the dentist.
We haven't gone there yet. But it does make me think too. So, and there, along those lines, I had this discussion again with my wife about cosmetology issues, and, there's a place in town where you can go and put lipstick on, check the color, see if it's okay, little tubes. And it's like, well, then they supposedly spray them, I guess, or something, No, you laugh.
I know,
But
I'm
they,
just-
that's not so unusual. I don't know if, you've seen that, but
I
But-
wouldn't.
I know, you wouldn't, you're here.
I
But,
think they'd say samples, not for reuse or something, but.
you know, and I
Little
asked,
sticks
I
they're
asked,
supposed to use.
right, you're
Yeah.
supposed to use sticks, but they don't, and,
Yeah.
and a lot of people don't, and I, nurse went down to the mall in Stanford to see what they're doing there, and it's, you know, it's tubes, check the color. And so I asked the question, and I'll ask the question to the public too, what would you think if CVS had tubes of different flavored chapstick out? Would you try it? You know, I can imagine the calls we would get, you know, what are they doing?
Yeah.
But it's a little different for, I guess, cosmetics for some reason.
Well, that also brings to my mind where they're gonna be banning these straws from the restaurants and plastic straws, or maybe they can get paper ones, but if they don't, and people are just using the glasses, how are they sterilizing them in the restaurants too? You know, I wonder sometimes, are they really clean?
Well, if they run it through the dishwasher, they are, and if the dishwasher's
So,
running
so
right.
There'd have to be a certain temperature and.
Yeah.
you
Well,
know,
that's one of the things that we check every
You
time
do?
we go
Okay.
into a facility is,
sterilizing.
you know, if it's at the bar, you know, when they go like this,
Yeah.
that's not adequate, you know, and so, you know, there is a time frame where they're supposed to be in contact with sanitizer. But if they're going through the dishwasher, you can be pretty sure that most of the time, and we have gone into places where the dishwashers aren't working properly, and that's the value of doing inspections, is to find that stuff when it's happening. Hopefully, you know, it hasn't been going on for too long before we got there, but we do find that, you know. So those are some upcoming events that we're planning. The DNA study, it's still going. I just recently did a presentation out in Long Island. The Long Island Sound Research Conference. And also found from the USGS that they're doing their own, trying out their own system of the DNA source tracking. It's a science in its infancy, but again, you know, we're still the first area, this group that we work together on, we're the only ones that have done this kind of testing in Long Island Sound so far. And we're doing a presentation in Nashville, National Environmental Health Association Annual Conference, coming up in July. And we're looking for more money so that we could actually find out where the bacteria are coming from every time it rains, because we really didn't. Emergency preparedness, Connecticut is in the process of reorganizing once again how they do regional planning for the emergencies. We'll see how that works out. Radon, we've given out radon test kits, made them available to the public. Unfortunately, only 24 people took advantage of the free test kits, and of those, only 12, we've only gotten results from 12. I think next time we'll charge people for them. Maybe they'll use them. I don't know, just kidding. But anyway, we really, in the years of doing this, and we've been doing this for, I don't know, 6 or 7 years, there's a fair amount of interest. It varies a little bit from year to year, but we really haven't found that we have any kind of like really hot spots in town, unlike other communities in Connecticut, so I'm pleased to report that anyway. We'll be doing ticks, submitting ticks again to the Ag Station. We started getting our first ones in. It's still a little cool, but we've gotten a couple in that we've submitted. The state will begin testing mosquitoes in June. And as needed, we'll advise the public. We'll start up our pool inspection program in May. Try to get every pool inspected before they open, before Memorial Day, to ensure that, you know, the equipment is there, the safety equipment's there, that the filters are running properly, and that they have people running the pools, keeping track of the pools, who know how to run a pool. Historically, we found that for the most part, the pools they do a good job. They do a good job here in town. And we began beach water sampling in May, before Memorial Day, and we do beach sampling once a week between Memorial Day and Labor Day. Occasionally, we'll take a sample from the Y in Holly Pond just to make sure that, because there's a lot of youth activities that take place in the pond there with sailing and so on. And our protocol is to notify Parks and Rec if we get more than an inch of rain, because we know that when we get more than an inch of rain, the bacteria counts exceed EPA standards for safe bathing water, which was the reason that we did the DNA study to find out what kind of bacteria, where the bacteria are actually coming from. So that's why we have such an interest in that, and we're going to keep doing that.
About the beaches and sampling of the water in the beaches, my concern at Weed Beach is where they've allowed these dogs to run on the beaches through March. I guess I'm not sure of the date. I know I stopped going to the beach for walks because of the dogs. But is this going to affect the sampling and when it should be sampled if we've got more dogs there?
No.
Well, that's not during the time that people are using the beach for swimming. You know,
No,
there's no
but-
lifeguards.
But I don't know when they're going to go through, and how long it takes for a dog excreta to not show any bacteria or whatnot. You know, how long does it stay around?
Well,
Especially if we
Greenwich
have
is-
a warming spell.
Yeah, and Greenwich, they basically did this, Greenwich has done this for years, and it's worked out well, and they have a bigger beach than we have. But they did it as a test program, I'm sure they're gonna be evaluating it.
Yeah, I don't know the answer how long bacteria is viable, from dog, but, if you're looking at it through March and then you have 2 months, I can't imagine that there would be any residue from the 2-month period. I think we're gonna have more
Children will be playing on the beach.
well,
Well, but also, I did not take my dog down there, but you're supposed to pick up after your dog, you're not supposed to leave it, and believe me, the Parks Department was all over that, they were probably making sure, because they want it to work,
Yeah.
so they're not gonna.
yeah, so,
Yeah.
I've actually, the Parks Department, and I've talked to the Parks Director about it, and, our opinion is that there shouldn't be a problem associated with that time frame overlap. I'm not even, if people picked up after their dogs, I'm not even sure it would matter if it was even the same day. Because I think there's other sources of bacteria that are going to be far more prevalent. But it's, there is a requirement to pick up after your dog anyway. And the beach is no different than anywhere else.
As long as people adhere to it.
Yeah, I know, but you're always, that's the issue. There's always gonna be somebody, or a time when.
Oh, it's true of all the parks.
It is. I know that there's been some discussion at the parks also about banning smoking,
Mhm.
so we'll see how that plays out. It's been on their agenda,
Yeah.
which was a suggestion that we had made to them too. Finally, this year was the first year in a couple of years where the state hasn't been pushing regionalization on health departments. I guess this year the focus was on schools and, other entities, but not health departments. So I guess they figured that what they would do would be to give us more work instead, and no more money. Actually, a cut to local health. Currently, Darien gets no money from the state health department for per capita funding because we don't meet the minimum population requirement of 50,000. That is the carrot that they offered to have towns regionalize. Is to say, you don't get any money if you're under 50,000. So we don't get any state money, so if they cut the funds by 20%, it's not going to affect us. But it will affect a lot of departments, in particular the larger ones. And there are a couple of bills that represent tremendous amounts of additional responsibilities for local health. One is House Bill 7133, which has to do with blood lead levels of children. And the requirement currently is 20 deciliters of lead, and the proposal is to reduce it to 5. And if you take a look at this, in 2016, according to state statistics, there were 80 cases statewide that needed intervention based on the 20. If it's reduced to 5, the number would increase to 1,150. The financial implications of that, between relocation, family relocation to the communities, that would necessitate relocation, course abatement, testing, enforcement, the time aspect, the staffing requirements, the training, the calculations are incredible. We've done some calculations, and we submitted it to State Appropriations Committee and to Public Health Committee, appealing for some reasonableness in this, because this could seriously bankrupt the state. I can circulate and send you the testimony and some bullet points if you'd like to see, because this is a big deal. This is a big deal. I mean, it's hard to argue against, keeping children safe. In fact, you can't. But the statistics statewide show that over the past 10 years, lead levels have been declining across the board for all levels, whether it's 20 and whether it's 5, whether it's 10. The lead levels are coming down. So the system's working, screening is working, and conditions are getting better. This would have huge financial implications to the state and to municipalities and to health departments. Another bill, House Bill 6955, proposes the adoption of the International Property Maintenance Code. That sort of gets into the same type of thing. It's about healthy housing. And the state building inspector was very successful in deflecting this over, and the state health commissioner said, oh yeah, local health departments can do this. Healthy homes, they can do all this work. This is also draconian and very aggressive requirement for local health. Could get into doing inspections of all rental housing in between tenants on a statewide basis. In some cases, that's not a bad idea, because if there's a problem in a place, you can get it fixed. The problem is, who's going to do all this work? It takes people, and it takes trained people. Same thing with lead, and these people simply don't exist. They're not out there.
We have lead in the homes, okay, the paint chips and whatnot, and the blinds. But what about a lot of the homes, including my own, that the water, the pipes were put in 1940, and there's that, I think they call this curb stop, that goes, the fixture that's from the street going into the pipe, to the home, not in the home, that are made of lead. And when do they get replaced, if ever? And is that affecting the lead in the water in the home?
The
homeowners.
the water companies are required to test in certain parts of the distribution system for things like that. So some random locations where they actually do testing.
Yeah, because you could change the pipes in your home, but you still could get lead from the street, from some of the
Well, they're
fixtures
testing
there.
from some homes. They do test some. There's a few homes, and I checked that years ago when the Flint thing came up.
Yeah.
To see what do you do, and there's certain number of random sites in town, in every locality where public water is, where they test for that, just to make sure that it's not happening on a quote representative basis. But as I'll say to anybody, if you really want to make sure, you should get your water tested yourself.
And how about our schools? Are we testing them for lead?
Good question. As of today, I can tell you that I got a report from the schools today, because that issue's been circulated, that they did a complete study in 2017, and they tested each school, they tested kitchen and water faucets in each school, and there was like nothing found for lead in each of the schools. Now, they didn't test every sink, and they didn't test every faucet. It's again representative.
But like a random, yeah.
You know, you can't do, it's prohibitive, to do every sink, every faucet, But yes, they did do a complete survey of the schools in last year, 2017, 2 years ago. And there wasn't anything above the detectable limit in any of the faucets. Good news. I mentioned the state licensure of estheticians when talking about this stuff. Doesn't mean they have to read, though, right? Read the tubes they're using. And I mentioned the budget cut to local health proposed. We'll see how that plays out. So I suppose if we get tolls, maybe we won't get cut. I don't know.
Mm-hmm. Yeah.
So that's my report. If you have any questions, comments, or suggestions?
I have a suggestion, because when I was down at Weed Beach one day, and the person was spraying for around the islands and all that shrubbery that they put there, and I asked him what he was spraying with, and it's not far from the playground, and he said Roundup. So
Sorry.
I'm wondering about using some of these things, especially in areas where there's children and pets and whatnot, and of course the person spraying. But can we look into what kind of herbicides and pesticides they might be using in areas where the public goes frequently?
I'll make a note
Thank
to
you.
check with the Parks Department.
Okay. Mm.
In the past, you've said you've had good success with high school students with their internship. Will that be happening again? Will you be using someone from the high school in the spring when they have that window of internships?
I wasn't contacted this year.
Mm-hmm.
I'm not sure. I don't know yet, but I haven't had
Maybe it's
anybody.
too early.
No, actually, I think it's not, because it would be, I think generally by now I know who it's gonna be,
Mhm.
but I haven't heard from anybody this year. Usually somebody from the school reaches out, but I didn't hear from anyone. We've had some really, really
Well, that's why
top-notch.
I remember that.
Oh my God, yeah, we've had some top-notch kids come through
Mhm.
over the years. And I truly enjoy doing that. I think it's a
Mhm.
great way to kind of, it's, people don't know all the different things that we do
Mhm.
and how many different things we're involved in. And that is a good way to open up their eyes to public health.
Mhm.
What's the position involved?
Whatever we can think of at that particular time. It's generally what's the issue then?
Right.
And there was, I think last year, we focused on wells and public wells and getting information out to homeowners about wells.
Right, right.
The year before, I had trouble keeping up with the intern from the year before, and we did salons. She did a complete Twitter program where it was a 4-part Twitter notification program on things to watch for in salons that I'm digging back out to put back up, to circulate it because it was so good. Health in Your Hands is a brochure that she developed. It was something about opiates.
Is it a?
Radon.
Yep. Is it paid, or is it volunteer, or is it?
It's
Yeah, the
it's
policy of the school is you can't, they want an even playing field, so it's all gratis, there's no pay.
Okay.
But they get out of school for the last month.
Yeah, it's
It's-
that window when the kids are all done with, they've taken their AP exams, they're all done, and they have like a month before they graduate.
5 hours a day. Come in 5 hours a day, and some kids are more efficient with their 5 hours a day than others. It's amazing how different
Yep.
the kids are, you know, and so, but it's been really good. But to answer your question, no, I don't have anyone lined up for this year yet. Is that it?
Okay. Motion to adjourn?
Yeah.
Agreed.
Time.
Thank you.
Time is, call it 8,